My name is Dr. Michael Lee of Body and Logic MD of Miami, and I first started out doing OBGYN, where I became a clinical professor, assistant professor at the University of Miami, and then before that I was a faculty member at Tulane University, teaching a lot of people how to be OBGYNs. And then I started making a transition into bioidentical hormone replacement therapy within my practice at the University of Miami. And then I started attending the A4M conferences, and I decided to join Body Logic MD and open up a practice, mostly doing bioidentical hormone replacement for men and women. The majority of the patients that I see come in for symptoms, especially the women late 30s, 40s up through menopause, and then the men generally maybe early 40s, mid 40s and on up. So I'm seeing both men and women. Women, late 30s, 40s, PMS like they didn't used to have before, moodiness, trouble sleeping, the periods start getting a little bit out of whack. Those are the big ones. For men, it's kind of a slow, gradual change. Men lose their hormones very slowly over time, 1 to 2% per year. And you see kind of the same issues also, trouble sleeping, libido issues, erectile dysfunction, energy at the end of the day particularly. And those are the people I'm treating. We encourage them to do the testing that's involved to measure their hormones, whether it be saliva, blood, serum, or urine even. And they show up to the office, and I take pride in not looking at the results before I see them. Because as doctors, we're all trained to listen to the patients, and that's where most of the clinical judgments should be made. And then we verify with testing. And I look at the results with the patients together for the first time. And then we come up with a plan which usually involves, always involves lifestyle changes, behavior modification, and that's the tough one. Hormones, if appropriate, and nutraceuticals, vitamins and supplements. And a lot of patients are very happy to get a medical doctor giving advice about vitamins and supplements, and that's lost in traditional medicine.
When my wife introduced me to this whole concept and the whole idea of bioidentical hormones through Body Logic, it was kind of scary at first, but then it really makes a lot of sense. It's really matching your hormone levels in a natural way to bring it back to a level where you do feel better. And it's dramatically improved our lives, and I would suggest it to anyone. It's wonderful. It just gives you a new way to look forward to life, because I can tell you, from personal experience, when your testosterone levels are dipping down to a level that's pretty low, you don't have the energy or the ability or even the desire to do a lot of things. And this gets you back in the game.
We have a lot of years left.
So if you'd like to contact me, go to bodylogicmd.com and click on Miami for physicians' locations, and we can set you up very quickly.